Hey everybody, thanks for being here. I think a couple more people are coming in right now. But just want to welcome you to an informational webinar from the Celiac Clinic at Stanford Medicine Children's Health. Um, Hopefully you're in the right place. I think you will be. But tonight we're going to be discussing how to choose safe gluten-free products, such as medications and supplements and personal products. Um, I think unless anybody, objects, I think we should get going. Alexandra, is that okay with everybody, or should we wait for a few more minutes? Okay, great. Well, again, welcome. My name is Garret Forshee. I'm a social worker with the Celiac Clinic. Um, I'm going to be moderating tonight's talk because we have a far more qualified expert on the topic, Erin McDonnell, who is my co-presenter tonight. Um, but yeah, let's get started. If you can go to the next slide, please. Just going to be showing you guys a little bit about what to expect tonight. We're going to start out just with a short introduction about myself and Erin. We're going to go over some basic information about celiac disease. We're going to cover oral versus topical exposure to gluten. We're going to kind of summarize all the information that we heard, and then move into some adjacent topics like when to worry about my products, and some expectation setting and acceptance work that we that we recommend and that we can talk about a little bit more. As said in the chat box, please send all your questions to the chat box and they'll be addressed at the end of the presentation. Definitely feel free to write them throughout. We don't want you to forget your questions, but we will save all the questions for the end. We have a allotted time for that. So thanks again for being here. And yeah, let's get started. So I'll start with myself. My name is Garret Forshee. I'm an advanced clinical social worker. I work for the Center of IBD and Celiac Disease. I started in 2020 at Stanford. I've been a licensed clinical social worker since 2015. I actually personally was diagnosed with celiac disease in 2015 through an EGD and biopsies after some indigestion. I've been a medical social worker for 7 years in different hospital settings and doing social work since about 2012. In my current position, I use psychosocial assessments, supportive counseling, assistance with resources, empathy, reflecting, reflective listening, sorry, and validation to help our patients and families adjust to their illness and cope effectively. And Erin, you mind introducing yourself?
Yeah, absolutely. Hi, everyone. My name's Erin. I'm a registered dietitian. I work here in the pediatric GI clinic at Stanford Children's Health. Typically, my main focus on a day-to-day basis is working with patients who require nutrition support, but I definitely have a soft spot for those patients with celiac disease as well. My partner actually has celiac disease, and he wasn't diagnosed until he was 19 after dealing with a lot of unexplained symptoms his whole life. So going gluten-free was very life-changing for him, and we tend to keep our home very gluten-free. In terms of food, I love cooking, I love baking gluten-free things, and have a lot of fun with that. But it is kind of interesting, the medications and personal care products aren't something that we at home have focused a lot on or had to from a symptom standpoint for him. So it was actually a really fun learning experience for me to kind of put together this presentation. So I'm very excited to share with all of you the things that I've learned.
Thanks, Erin. So we can move on to the, I believe, the basics of celiac disease and gluten. So what is gluten? As a social worker, I'm going to do my best to talk about these things. I'm sure everybody knows, but just to kind of set the foundation for this presentation, gluten is a type of protein that is found in wheat, barley, rye, and some oats. It's what makes dough stretchy, elasticy, and it gives baked goods that rise in that elastic and chewy texture. Gluten can be passed along unintentionally, just like germs, like a virus or a cold, by people or objects such as cookware, packaging materials, stuff like that, which is known as cross-contamination. What is celiac disease? Celiac disease is an autoimmune disorder, meaning that the exposure to gluten causes the body to attack itself. In other words, the immune system overreacts to the protein, causing damage to the villi, which are small finger-like projections in the intestinal walls. And when those villi are damaged, they don't absorb nutrients from foods that are ingested, and then if left untreated, celiac disease can cause symptoms such as diarrhea, bloating, indigestion, abdominal pain, joint or bone pain, fatigue, constipation, gas, weight loss, slow growth, headaches, brain fog, rashes, weight loss, mood changes, and delayed puberty, to name a few, to name most of them, I think. And as most of you know, removal of gluten from the diet is the only effective treatment for celiac disease. Next slide. And thankfully, I can pass this topic over to Erin, our expert on the matter, choosing safe personal products. Go for it.
Awesome. Thanks, Garrett. So when we think about gluten in medications, supplements, and personal products, I think the big picture question that comes to mind, at least for me, is sort of when should I worry about my personal products and what types of products should I be thinking about switching out for a gluten-free option? And I think that's probably why all of you are here tonight, is to kind of think about that as well. So I put in this quote from Dr. Fasano, which I think summarizes it pretty well in terms of the current state of the literature. And so I am going to read the whole quote. Apologies for reading the whole slide, but I think it's important. So he says, there is currently no scientific evidence that gluten used in cosmetics that are not ingested is harmful to individuals with celiac disease, including those with dermatitis herpetiformis, the skin form of celiac disease. If you have celiac disease, then the application of gluten-containing products to the skin should not be a problem unless you have skin lesions that allow gluten to be absorbed systemically in great quantities. The reason why this should not be a problem is that based on what we know right now, it is the oral ingestion of gluten that activates the immunological cascades, leading to the autoimmune process typical of celiac disease. So basically, to paraphrase, if you don't eat it, don't worry about it. It's kind of my takeaway from this. But as I did some more digging, I realized this quote is a little old. I think there's been a little more research since then. And I think overall, this is generally correct, but there's also a little more nuance to it. So I want to talk through some of that. So the skin form of celiac disease is triggered by ingestion of gluten, not by skin contact, and it can cause itchy, blistering, painful rash that can affect any part of the skin. However, there was one small study, pretty small, like 14 participants in Italy, which found that some patients with celiac disease had a cutaneous or a skin sensitivity to products that contained gluten, and it improved when they stopped using those products. So the sample size was small, but the people who performed the study or who did the study argue that they did the study because they had so many different patients with celiac disease coming to them complaining of skin issues. Unfortunately, this was the only study I could really find that on specifically gluten on the skin. But I did find a lot of research that suggests that those with celiac disease or with other autoimmune conditions are also more likely to have atopic dermatitis or other skin conditions. So it could be that those with celiac disease are in general more likely to be sensitive to skin products. And it's still, I think, up for debate whether it's the gluten in those products that is causing that issue versus just another type of sensitivity. But I think, whether the sensitivity is due to gluten in the product and having celiac disease or being due to a separate sensitivity, it does make the case for being more thoughtful about the products that you purchase if you have celiac disease, even if they're not necessarily products that are going to be ingested. But things that are ingested are probably the biggest risk, right? So medications and supplements. And I think we had sent out sort of a survey in advance, and most of the questions that came back were regarding medications. So I think others are also thinking along those same lines. So let's talk through those first. So I'm sure most of you are aware of this, but the FDA has some rules around labeling of the major allergens in food and in dietary supplements. And so those major allergens are milk, eggs, wheat, shellfish, tree nuts, peanuts, wheat, and soybeans. And then as of January of last year, sesame is included in that list as well. And then dietary supplements are things like vitamins, minerals, botanicals, herbs, amino acids, and probiotics. But unfortunately, drugs, so things like ibuprofen, pain medications, prescription medications, are not included in that category. So they would not necessarily have to label allergens. And even if, the allergen wheat is labeled, that doesn't mean there couldn't be other sources of gluten in any of these products. So the labeling is a little lacking. The FDA does provide recommendations for manufacturers on how to label gluten in drug products. But they are still at this point optional. So I think there are manufacturers out there who choose to do that. There's also a lot of manufacturers out there who do not choose to follow those recommendations. And then I thought it was really interesting to learn that there is a Gluten in Medicine Disclosure Act kind of in the works. It was introduced to the House in 2021. And so if it were passed, it would require gluten to be labeled in all medications, which would be pretty amazing. But until then, we do have to be careful about the drugs. And so my goal is to give you some tools to help out with that. And I think the first thing to keep in mind is really the distinction between wheat and gluten, right? So just because something is wheat-free does not mean it's gluten-free. It could contain barley, it could contain rye, it could contain oats that were, cross-contaminated with gluten during manufacturing, which is pretty common. Same thing, if it's allergen-free, that means it's wheat-free. It does not mean it's gluten-free. And then kosher also does not automatically mean gluten-free. In fact, to be like Passover kosher bread, it has to use one of 5 types of grain, which is wheat, barley, rye, spelt, or oats. So it's actually unlikely, or maybe a little less likely, to be gluten-free for that reason. So how do we think about this? Luckily, gluten is not actually super common in most medications, at least not in the medicine part itself. But it is sometimes used in the inactive ingredients to provide bulk or slow absorption. And so there are a few ingredients, which I've put in a list here for you. You can always come back to this and check it out later, of ingredients to look for that would pose the largest risk of potentially containing gluten. So when you're looking at medications, you want to look for kind of this list here in the tan color in the middle. And probably the biggest risk is a starch of some kind. So any unspecified starch. There could be a specific starch like cornstarch or potato starch. If that's the case, they specify where it's from. You shouldn't need to worry about it. It's not from wheat, barley, rye. You should be safe. But if it's not specified, then it could potentially come from a gluten-containing source. Things like dextrin and caramel color are potentially from barley malt. So those can also be sources of gluten. But then to throw a wrench in it and be more confusing, if it just says gluten, it could be gluten from corn, or it could be gluten from wheat. And manufacturers sometimes just don't specify. And then one more layer of slight confusion, I think, is, it could say derived from a wheat source, but usually when you see that phrase derived from a wheat source, it actually is referring to sugar alcohols like mannitol, sorbitol, etc. in this list at the bottom, which are so refined that they actually don't contain gluten. So potentially something that says derived from a wheat source could be safe. Potentially something that says gluten could be safe if it's from corn. So it is confusing, and I absolutely understand why people are confused by this. So your first step is look at the label, see if any of these sort of unspecified starches or glutens are listed. If they are, your next step is basically to do your due diligence. It's pretty unlikely that anything other than an unspecified starch is gonna be gluten. And cross contact is also pretty unlikely, just because the FDA has such stringent requirements about their drug manufacturing practices that cross contact, even if some product in the facility uses gluten, is pretty unlikely. But if you do see that unspecified starch on the label, you'll want to do some research. I really like this gluten and medications, this glutenfreedrugs.com website. It's literally a list of like every medication you can think of in alphabetical order, and it ranks its gluten-free status from 1 to 5, 1 being, does not contain gluten, or I think 1 being, does not contain gluten, 4 is contains gluten, 5 is contains sugar alcohols. So it actually has some of those nuances built into their ranking, which is super helpful. And then this Daily Med resource is also helpful, just in that you can look up pretty much any medication and get a complete ingredient list. And if there are specific allergens in it, it should list those as well. If you can't find what you're looking for with those resources, this Daily Med website actually has the manufacturer information and contact information for most drugs too. And they should be on the bottle somewhere, but you can reach out to the manufacturer. And sort of the main thing is to ask, does the product contain gluten? Does it contain starch? And then to really specify what the source of that gluten or that starch is. And of course, if it is a wheat, barley, rye, or even oat, to sort of avoid that product and choose a different product. And I know someone had asked about ibuprofen and whether ibuprofen is had been tested or is safe. And from what I could find, most sort of pain medications from big name brand manufacturers are unlikely to have gluten, but the manufacturer doesn't actually say gluten-free or does not contain gluten, because they are often manufactured in a facility where there could be gluten. So they aren't able to make that claim. But luckily, a lot of the off brands, so the sort of store brands like Target, CVS, Walgreens, have their own generic painkillers, and many of those are actually labeled gluten-free now. So it is possible to find like sort of certified gluten-free options there. Okay, so that's sort of the quick spiel on meds. Happy to answer any questions afterwards, but I'm going to move on to sort of other products. And when I think about products that are not medications and supplements, so other personal products, I sort of think about them in 2 broad categories. One is products that have some risk of being ingested, right? Because that really is the biggest risk with celiac disease. And then the other is the products that really don't have a whole lot of risk of being ingested, but if for whatever reason you want to avoid gluten, even in those products, they would be something to think about. Or if you do tend to have pretty sensitive skin, it might be something to think about. So starting with products that could be ingested, first thing that comes to mind is something like lipstick or chapstick, just because of proximity to the mouth. So there's definitely a possibility of ingesting it. And then I also think about like younger kids and flavored, delicious smelling lipsticks and chapsticks. I've absolutely heard of small children like eating those. So again, having those lying around, if they're full of gluten and you have a young kiddo with celiac, it might be something to think about, and would have more of a risk. That said, there was one small study that tested some lipsticks that actually did contain wheat, barley, rye, or oat ingredients. And when they sent it to the lab unopened, straight out of the package, and had it tested for gluten, they were not able to find measurable levels of gluten, even though they contained those ingredients. So we still don't know how much of a real true risk this is, even if it were ingested. But I think it is something to be aware of. And I think celiac, beyondceliac.org has like a huge list of lip care brands that offer gluten-free products, and then a lot of good resources on kind of what to look for in those products. But I put a list here of ingredients to watch out for. In makeup, they tend to like to use the Latin names for things for some reason in their ingredient lists. So beyond looking for wheat, barley, rye, oats, you're going to look for a bunch of these other complicated words that I am not going to pronounce on this presentation, but it is here for your reference. And I think you can find this on this website as well if you look at my sources at the end. And then if you are really worried, same thing, if you have like a lipstick that you love and there is no ingredient list available, or you're unsure, you can absolutely still just reach out to the manufacturer and ask about gluten or gluten-containing product ingredients. Other products that might have some risk of being ingested just because of, again, proximity to the mouth are things like toothpaste, mouthwash. Again, most people don't drink their mouthwash or swallow their toothpaste, but if you have little ones who like to swallow their toothpaste, it might be something to think about. Generally, they actually don't. Most toothpaste does not contain any gluten ingredients, and mouthwash typically doesn't either. So it's not a huge risk. Most like major toothpaste brands don't label their toothpaste as gluten-free, but again, it doesn't typically contain ingredients that are likely to have gluten. But if you're super worried, you have a kid at home that loves to eat their toothpaste or whatever it is, there are some labeled gluten-free toothpaste options out there. I put a couple brands that I know of here. And then as always, like just double check ingredients for any product that I'm recommending, just in case ingredients have changed or something like that. Other things, less risk, but a little bit of risk of ingestion still would be something to keep in the back of your mind. So soaps, lotions, and hand sanitizers that could leave a residue on your hand if you're sort of sanitizing a lot and then grabbing food, eating it. That could be maybe some kind of risk. Again, I don't think it's a high risk, but it's something to sort of be aware of. Most sanitizers don't contain gluten, but wheat and oats are a pretty good moisturizer. So a lot of like hand soaps and hand lotions will contain gluten ingredients. Play-Doh, I think most people in the celiac world are aware that Play-Doh is made from wheat flour. Again, if you're not eating it, it shouldn't be an issue to play with it. However, if you're a little kid and you're, playing with Play-Doh and then putting your hands in your mouth or kind of licking that saltiness off your hands that you get from Play-Doh, which I think a lot of kids do, that might be something to stay away from. And there are a lot of gluten-free Play-Doh recipes online that you can find. So you can absolutely make your own. So kids don't have to miss out on that fun. Retainers. This one was a new one for me. I'm not convinced, honestly, that we have to worry about our retainers. But there was one case study that I found, and basically they found that, a kid with celiac disease was unable to achieve remission, even though they were following a strict gluten-free diet. And they eventually suspected that the type of plastic in the retainer was the source of gluten. And once they stopped using the retainer, then the patient was able to achieve remission. And so I don't know how much stock I put into this, but basically there was no analysis on the retainer, but it is something to really tuck away in the back of your head in case you try everything else and nothing else works and you happen to wear a retainer sort of situation. Fluoride and polishing paste, similar to toothpaste, really shouldn't contain gluten, but you can check with your dentist if you're worried. And there's a big list on this website as well. Okay, and Garrett just pinged me. I'm running a little bit slower than I thought, but we'll switch over to topical personal products. So overall, the research shows that gluten should not cause a reaction in those with celiac disease if it's just applied topically. But again, there are those who might prefer to choose the gluten-free products for peace of mind, or if there's a young kid in the home who might get into things or put things in their mouth that don't belong there, things like that. So unfortunately, skincare products and cosmetics are not included under the FDA's gluten-free labeling rule. They're not subject to any of the allergen labeling acts. It can be kind of hard to find ingredient labels for them. In California, we have a little bit more protection, but even the list of reportable ingredients in California doesn't include gluten. There is a Personal Care Product Safety Act that was introduced to the Senate, and that would actually require cosmetics brands to at least list all of their ingredients, which would be a step in the right direction. But it can be hard to navigate. So again, here's a list for your reference of all the normal and Latin words for things that might be in different sort of skincare products. And like I mentioned, wheat and oats are pretty common in things like lotions and sunscreens and primer and foundation and skin scrubs and any other kind of moisturizer. So if you are having a skin reaction, I would definitely recommend, of course, discontinue the product. You can look for something that is gluten-free or maybe even something that's just made for sensitive skin. But I would check with your doctor or your allergist, because it could be possible that you have a separate type of sensitivity that's causing that skin reaction, particularly knowing that with celiac disease, there's a little higher risk of having skin conditions in general. And then here are a bunch of brands that do offer certified gluten-free personal care cosmetics and sunscreens and lipsticks and chapsticks and all of those fun things. So I think this is just a sampling. There's a lot of other lists out there online that you can always check out as well. All right, and in summary, medications and supplements, check them for gluten, avoid them if they contain gluten, look for alternatives that don't contain gluten ingredients or that are labeled as gluten-free. In general, any other personal product that is used topically, even the lipstick and the toothpaste, should be fine to use, even if it is not gluten-free, unless you think there's some likelihood of ingesting it in kind of larger amounts, in which case, in the case of like young kids, for example, I might think about getting a gluten-free product. And then there are definitely circumstances where we would think about going into a deeper dive into your products to look for sources of gluten or cross contact. And so I'm going to turn it back over to Garrett to sort of talk about that and then close us out with kind of the big message, which is don't worry too much. But there you go, Garrett, take it away.
Thank you. Thank you for all that. Definitely taking notes for myself as well. But yeah, let's just end the presentation about on this note about when we should worry about our gluten-free products or about our products in general for the presence of gluten. Go for it. Next slide, please. I want you all to give yourself the freedom to worry and investigate, kind of do a deep dive on your products when symptoms that are associated with exposure to gluten continue to occur even while following a gluten-free diet. Lab results also indicate that there's gluten getting into your system that is tough to explain. Meeting with the dietitian does not clarify the sources of the gluten. After doing, looking over at your kitchen, and you've gotten rid of all the possible ingredients, problematic areas or cookware, things that can potentially cause cross-contamination. If that hasn't, fixed the labs or the symptoms, then maybe it's time to do a deeper dive. Investigation into favorite restaurants, takeout spots, if those don't indicate a possibility for exposure to gluten or cross-contamination, and especially if symptoms are significantly impacting quality of life, and all these steps have been taken, all this research has been done, that's a great time to be, to escalate the worry or stress about your products that you're using. Next slide, please. What to do when we have questions about medications or products. Check out the product. Erin discussed a number of ways to look at the ingredients for your product. Go to the website for the manufacturer, contact the company, visit the Daily Med or the gluten-free medication list on that website that she provided. Talk to your doctor through MyChart or bring it up in a visit. Meet with a dietitian. This can be a really helpful, sometimes people may say tedious, but very detailed investigation into your daily activities and what you eat every day. And they can really help you find where that gluten might be sneaking in. Investigation also involving our kids and the patients. Talk to them, talk about the favorite restaurants they like to go to, take a good look around the kitchen. Also, please talk about the feelings that your child is having about the diet. Sometimes it may be harder than we realize, especially when they're on their own or in social situations, and gluten might be getting in there. And also throughout all this, hopefully we can also have some acceptance and reassurance. Acknowledge that no matter what we do, no matter what precautions we take, there is an inevitable possibility of gluten sneaking in, some accidental exposure happening. And we can plan to use available resources when that does happen. Next slide, please. And just a few more words about expectation setting and acceptance. It is understandable that parents and patients experience stress when trying to follow a gluten-free diet. In such an unpredictable world, it can be very difficult to balance out our emotional and physical quality of life. The gluten-free diet and lifestyle requires sacrifice from the patient, from the family, and some patients and families can actually take this concern a little bit too far, causing maybe too much stress. What we try to do is try to be objective, acknowledge that although there are a lot of resources that are available, a lot of information to help us keep our gluten-free diets, there are limits to the efficacy of those resources. We just encourage you all to do your best to help your child avoid gluten in school and social settings. Try to stick to the gluten-free diet, try to stick to safe restaurants and products, strategize on how to spot a gluten-containing product, and acknowledge that exposure to gluten is inevitable. It will happen at some point. And we encourage you to allow the severity of the symptoms or lab results help you gauge the appropriate intensity of your precaution and worry. Continue to work towards a gluten-free diet. It's an endless process. Don't expect perfection, especially when newly diagnosed. Next slide, please. And here are the sources that Erin used in her research, and this will be also available at sometime in the future. Next slide. And upcoming webinars, just like this one, there are great talks coming up that we want you to mark on your calendar and tell people about, so we continue to get good talks and good audiences. And yeah, this recording can be ended now. We can kind of move on to the question and answer portion of this presentation.